What if the biggest threat to your vision after a glaucoma diagnosis isn't the disease itself, but the simple, everyday mistakes people often make without realizing? It may seem surprising, but many individuals, even those diligently following their glaucoma treatment, unknowingly make choices that accelerate vision loss. And once that sight is gone, there's no way to bring it back. Glaucoma affects more than 3 million people in the US, with older adults being especially vulnerable. It's one of the leading causes of blindness. While treatments like eye drops, surgery, and laser procedures are available, they can only do their job if we're not unknowingly working against them. In this video, we'll uncover 8 common but critical mistakes to avoid after a glaucoma diagnosis. These insights, supported by both research and real patient experiences, could help preserve your vision and quality of life. Chances are, you might already be making one of these mistakes without even realizing it. So stay with us, because what you learn today might make all the difference in protecting your sight long-term. Glaucoma isn't just about occasional eye pressure. It's a progressive and often silent condition that slowly damages the optic nerve, the crucial pathway that sends visual signals from your eyes to your brain. Imagine a worn electrical wire inside your home. You don't notice the damage at first, but eventually, the lights begin to flicker. That's what glaucoma does to your vision. The cause is usually an increase in eye pressure that goes unnoticed for years. That's why glaucoma is often called the silent thief of sight. It doesn't matter whether you're in your early 60s or your 80s, glaucoma doesn't care about age. Unfortunately, nearly half of those affected don't even know they have it. It's like living with a hidden gas leak, dangerous, silent, and potentially devastating. Open-angle glaucoma is the most common type, but regardless of the form, the risk remains the same: irreversible vision loss. There are ways to slow the progression, but it all starts with knowing what not to do next. Number 1. Never skip your eye drops. Think of your vision like a delicate garden. If you only water it occasionally, everything starts to wither. That's exactly what happens when glaucoma medication, especially eye drops, is skipped. These tiny bottles aren't just routine, they're your frontline defense in glaucoma treatment. They help control eye pressure and protect the optic nerve from further damage, even when symptoms aren't noticeable. Yet studies show that nearly half of patients don't use their drops as prescribed. Whether it's due to forgetfulness, discomfort, or simply thinking they feel fine, missing doses allows pressure to build, and that can lead to irreversible vision loss. This isn't like skipping a vitamin or a supplement. This is about preventing permanent damage to your sight. If remembering is tough, try setting a phone reminder, linking drop time to brushing your teeth, or using a daily organizer. Even asking a family member for help is a smart, proactive move. Being consistent with your drops means staying consistent with your vision. It's a habit that pays off every single day, and unfortunately, many don't realize just how silent the damage can be. Number 2. Don't rely on symptoms alone. One of the most difficult things about glaucoma is that it often doesn't feel like anything is wrong. There's usually no pain, no blurriness, no flashing lights, just silence. And that silence is what makes it so dangerous. Many people assume that if something were truly wrong with their vision, they'd notice. But glaucoma symptoms often begin with subtle changes, like peripheral vision fading so gradually it goes unnoticed, almost like shadows slipping in around the edges of a photograph. By the time those changes are obvious, the damage to the optic nerve may already be permanent. That's why routine glaucoma management isn't optional, it's essential. Regular eye pressure checks, visual field testing, and scans of the optic nerve act like a warning system, helping catch problems before they get out of hand. Ignoring those tests is a bit like driving without checking your dashboard. Sooner or later, something critical could fail. For anyone serious about preserving their vision, it's important to rely on consistent monitoring, not on how your eyes feel. Because by the time something feels off, prevention might no longer be possible. And as we'll see next, there's another common habit that can quietly undermine your treatment without you even realizing it. Number 3. Never self-medicate or stop meds without your doctor. It's natural to want control over your health, and when your eyes feel fine, it can be tempting to think you no longer need your glaucoma medication. But glaucoma is relentless. It doesn't pause just because the symptoms seem to. Stopping your treatment or trying out herbal teas, supplements, or over-the-counter eye drops without speaking to your doctor is risky. It's like patching a leaking pipe with tape. It might seem to work for a while, but the damage keeps building underneath. While natural remedies can sound harmless, many have been shown to interfere with prescription medications or raise intraocular pressure, making your condition worse. Even reputable sources like Ophthalmology Times have cautioned against so-called miracle cures that aren't backed by science. The most important thing to remember is that your ophthalmologist isn't just someone who writes prescriptions. They're a partner in protecting your vision. If something about your medication concerns you, whether it's side effects or results, don't guess, ask. Bringing it up isn't overreacting, it's being proactive. And as we're about to see, some of the pressure you're putting on your eyes might be hiding in your daily routine. Number 4. Avoid heavy lifting and certain yoga positions. Here's something that catches many people off guard. Not all forms of exercise are safe when you're managing glaucoma. Some physical activities, particularly those involving strain or inverted positions, can cause sharp spikes in eye pressure. Imagine lifting heavy weights or doing a headstand in yoga. Your intraocular pressure can rise quickly, putting added stress on your optic nerve. Research, including findings from PLOS One, confirms that certain movements can significantly increase this pressure. That doesn't mean you need to stop exercising altogether. Staying active is essential for senior eye health and your overall well-being. The key is to focus on low-impact, eye-friendly options. Try a brisk walk in the morning, join a local Tai Chi class, or swim a few relaxing laps. These activities support glaucoma management without the risk of sudden pressure changes. Choosing the right form of movement protects not just your eyes, but your independence and daily function. But while you may be mindful of exercise, there's another silent risk that often goes unchecked, and it's one many people find hard to give up. Number 5. Don't smoke or ignore blood pressure. If you've been brushing off blood pressure checks or still lighting the occasional cigarette, it's time to take a closer look, because these habits directly impact your eyes. Smoking doesn't just affect your lungs, it reduces oxygen flow and weakens blood vessels, making it harder for the optic nerve to receive the nourishment it needs. Combine that with unstable blood pressure, and you create conditions that make optic nerve damage more likely. Studies published in the Journal of Glaucoma even show that low diastolic pressure, not just high, can reduce blood flow to the optic nerve, worsening glaucoma symptoms over time. The solution lies in consistency. If you smoke, talk to your doctor about quitting strategies or support programs like those offered by the American Lung Association. And when managing blood pressure, aim for balance. No sharp spikes or drops, and no skipped medications. Home blood pressure monitors and tracking apps like Heartify or Omron can help you stay on top of it. In the world of aging and vision, steady circulation is one of your greatest allies. And one of the most reliable ways to stay ahead? It's a habit that often gets overlooked, but can make all the difference. Number 6. Never miss your eye appointments. It's easy to assume your vision is fine just because it feels that way, but with glaucoma, that assumption can be misleading. This condition often progresses without noticeable symptoms, which is why regular eye appointments are essential. Skipping them means missing the chance to catch subtle changes early, changes that could quietly affect your eyesight over time. Research published in Mayo Clinic Proceedings found that patients who stayed consistent with their eye exams experienced slower disease progression. These visits allow your doctor to monitor eye pressure, detect changes to the optic nerve, and adjust your glaucoma treatment as needed. It's not just routine, it's prevention in action. Life can get hectic, and appointments might slip your mind, but preserving your vision is worth the effort. A helpful strategy is to book your next visit before you even leave the office, then mark it in your calendar with a reminder. Because when it comes to protecting your eyes, consistency is key, and as we'll see next, even something as simple as a cold medicine could interfere with that progress. Number 7. Don't use certain over-the-counter medications. This one often slips under the radar. Some common over-the-counter cold and allergy medications, especially those with pseudoephedrine, can quietly interfere with your glaucoma treatment. These decongestants may seem harmless, but they can raise eye pressure, particularly in people with angle closure glaucoma or anyone at elevated risk. It's a hidden danger that can throw off your entire management routine. A study published in the Archives of Ophthalmology warned about how quickly these ingredients can trigger acute pressure spikes. And let's be honest, when you're dealing with a headache or stuffy nose, it's easy to grab the nearest option without reading the label. That's why it helps to check with your pharmacist or doctor before taking anything new. To stay on the safe side, keep a list of approved medications and alternatives. For example, steam inhalation or saline nasal rinses can often relieve symptoms without affecting your eye pressure. In glaucoma management, the problem isn't always what you forget, it can be what you take without realizing the risk. And there's one more risk that can creep in quietly, with effects that reach far beyond your eyes. Number 8. Don't isolate yourself or ignore mental health. Glaucoma doesn't just impact your vision, it can quietly affect your emotional well-being too. As vision changes begin, it's not uncommon to experience anxiety, fear, or a growing sense of isolation, especially later in life. And while it might seem easier to keep those feelings to yourself or downplay what you're going through, pulling away from others only makes things harder. Research from psychosomatic medicine has shown a clear connection between glaucoma and depression, particularly among older adults who feel cut off from support. But you're not alone in this. Whether it's joining a glaucoma support group, having regular conversations with friends, or simply taking part in local social activities like walking groups or game nights, staying connected can make a real difference. Therapy can also be a valuable tool, not just during a crisis, but as a form of regular mental maintenance. When your emotional health is steady, you're more likely to stay consistent with your glaucoma treatment, show up to your appointments, and stick with the healthy habits that protect your sight. Because managing glaucoma isn't just about the eyes, it's about the whole person. Now that you know the 8 things to avoid after a glaucoma diagnosis, the real question is, what changes are you ready to make? Will you be more consistent with your eye drops? Take a closer look at your daily habits? Maybe even schedule that appointment you've been meaning to? Glaucoma isn't something that's managed once and forgotten. It's a long-term journey, and the steps you take today will shape your vision for years to come. If this video helped you better understand how to care for your eyes, consider giving it a like and sharing it with someone who might need this information too. And if you'd like to keep learning how to stay healthy and informed as you age, be sure to subscribe and turn on notifications. Before you go, check out the video appearing on your screen now. It's filled with more valuable insights to help you stay ahead and take control of your health. Taking care of your eyes is just one part of the journey, and there's still so much more to explore.